there's a lot of terminology that y'all have to be familiar with as nurses or any type of healthcare practitioner, um, because it just really makes things really quick to describe. And it helps really describe and get people oriented to, well, healthcare professionals oriented to exactly where in the body is going on, or what part of the body is going on, rather than, it's that thingy right over there, and it's maybe 2 inches down. Yeah, no, it's the stuff is useful. It's a lot of information, but it really is useful. Bits and pieces that we're going to be looking at is one body position in particular. I don't know why I have that pluraled. Pluraled, is that a word either? I don't know what I'm doing anymore. Anyways, regional names, directional terms, planes and sections, as well as body cavities. So body positions, there's really only one that you should be familiar with. And here's the description for it, but we're going to go ahead and just look at this really quick. We're just going to sneak over to the regional names, and we're going to look at this position. It's called the anatomical position. The anatomical position is, as you can see, the face is forward, the palms are forward, the feet are forward, everything is straight. You know, little twisty turn here in the trunk. There's no twisty turn in the neck, twisty turn in the back. It's all facing forward. Palms, feet, toes, face. That is anatomical position. And a lot of the time when there's a chart, if you have to handwrite it in, or maybe, actually I'm thinking about to my ER days, you have to click on a part of the body, and and that little diagram that you click on is in anatomical position. So yeah, you're going to get used to this look, this preview. A lot of important parts and pieces here to point out. We got the cephalic portion, which is really just calling the head. So you got the cranial, which actually has housing the brain, and the facial, which is your face. You got frontal, temporal, that's your temples, really. Ones that I care about on the face is your otic, your ear, your nasal. I'm pretty certain y'all know nasal. Oral. I'm pretty certain y'all know oral. So like when somebody says, I need you to take this medicine orally, they're asking you to put it in your mouth and swallow it there. Don't try to rub a pill through your skin. It's not going to work. Mental. When you're thinking and you're being really pensive, you scratch your chin. You're being very mentally inclined. That's not the word I'm looking for, but here we are. Mentally inclined. We work our way down. We got ourselves cervical. There are actually bones in your back here on your spinal cord. They're called cervical. Hopefully that helps out with the neck thingy. Going down further, you got the thoracic, your chest region. If we turn the lady around, we got ourselves a scapula, this bone right here, so it's called the scapular region. Vertebral is called the vertebral region. Well, vertebral region, my word. Spinal cord, spinal column. We also have anything that pertains to the arm is referred to as brachial. And then between the arm and the thoracic region is your armpit. Your wonderful, stick your hand underneath it and move your arm up and down and make farty noises. Yes, I am mature. Don't judge me. This region y'all are going to be super familiar with as nurses is the antecubital region. That's pretty much the favored position of placing an IV. Antebrachial, ante or ante means before. So this is saying you're before acute brachial, the forearm. Then you got the carpals. If I were to say metacarpal syndrome, you go, oh yeah, that's what it means. And carpal bones. And that's your carpal, it's your wrist. Palmar. Where's the palmar? Palmar. Hopefully that's kind of familiar with you. That's the palm of your hand. If we work our way down, okay, we're done with the arms. We're done with the brachial region. Let's move down into the trunk. You kind of can see that further down in the trunk, this is called the abdominal region. Further down, you got the Bebo. Hello, Bebo. That's the umbilical region. Take a stab in the dark why it's called the umbilical region. Well, it's because the umbilical cord went there. You got the pelvic region because your pelvis is in that region, and then finally it breaks off into your legs. Your legs, starting off with the femoral. I bet y'all can figure out what this bone is and why this area is called the femoral, the femur. You got your kneecaps, which is your patellar. And then this one that I like to mispronounce, it's actually popliteal, but I like popliteal because it really emphasizes the pop, because that's how I remembered it. I'm an idiot, I'm a dork. But I just imagine myself just doing the squats, and each time I get back up straight, I go pop, because I just popped my knees into place. It's the popliteal region. Popliteal. Crural is your leg region. I should have pointed that one out earlier. Sorry. Then the pedal region is here, which is broken down into your tarsal as well, which is your ankle. Your phalanges. This is phalanges up here too. Phalanges is fingers and toes. Depends on what you want to talk about. So those are the major regional areas that you should really care about. For now. You also have directional terms. These ones kind of cover most of them quite nicely. Here's the list that you really do need to know. I know it's a lot of terms, but you'll thank me later because, yeah, you're going to use these a lot. But let's go ahead and point out a few of these on the picture. Proximal and distal. Most of the time, okay, I should say most of the time, refers to parts of your limb and how close it is to your trunk. The closer you get to your trunk, it's more proximal. So if I'm talking about fingers, this joint of the finger is the most distal joint of your finger, while the one that's closer to your metacarpals is actually more proximal. It's the proximal digit. Now, to practice, I would recommend you saying, okay, which one's more proximal? Is this part more proximal or is this part more proximal? Which part is more distal? Is this part more distal or is this part more distal? And then just choosing like different bones, different things that you already know or are familiar with, and then quizzing yourself on it and comparing it. To run with that same thought of how to study, let's look at the medial and lateral. Medial means more middle. It's your median. And then there's the lateral, meaning it's more to the sides. Lateral means, yeah, I think that's about right. It's about as clear as it's going to get. But taking that process again, which one, you're familiar with the heart, you're familiar with the lungs, that they're in your thoracic region. And, well, there's your heart right there. And is it more medial or is it more lateral to a lung? Well, yeah, it's more medial. Look at this part of the stomach. Is this part of the stomach more medial or lateral than this part of the stomach? This is the lateral portion of the stomach, and this is the medial portion of the stomach. Let's look at one more time. Hopefully this helps you remember the superior inferior part. I'm guessing this is pretty straightforward. I could be wrong. I've been wrong in the past, and I will probably continue to be wrong in the future. But the inferior portion, usually that's if we go lower class versus upper class comparison. The upper class always thought themselves as superior in every way, while they always considered the lower class inferior. So them toes, them toes. That's exactly how the superior would talk. Jerks. The toes would be the most inferior portion of your body. Your foot, the most inferior portion. While your brain, at the tippy top and the top of your skull, would be the most superior portion. Again, try out that practicing type of stuff. Let's point out a couple of other things that I kind of missed. First off, at the very bottom, you see superficial and deep. Superficial, when you're saying that somebody's superficial, it means like they're their emotions are right there at the surface. It's very apparent what they're trying to do, or that they are very easily offended. That's not me. Maybe it is. Don't judge me. While somebody that's deep, they express, they've had some moments to really think, and it's difficult to read them, or they have some really profound thoughts and you go, whoa, that's deep. So your heart is a lot deeper than your skin. Your skin is superficial. Your heart is deep. You could probably run with that exercise quite easily. I am actually getting close to... I'm going to actually stop this video here shortly because I don't really want to put too much information here together. I'll do the planes on a different one. Let me hit these last three terms right here. Intermediate, ipsilateral, contralateral real quick. Intermediate just refers to that it's stuck in between two things. So one that's really, really super easy to see is the heart and the lungs again. There's lungs on either side of the heart. Ipsilateral, contralateral, IPS lateral, contralateral. Remember that lateral is referring to a side. Ips means same. So it's the same side you're saying. Things are on the same side. So if you're saying there are lacerations on both, on the ipsilateral side, to the limbs on the... Wow. Anyways, to the limbs on both sides, then you're saying that it's ipsilateral. These lacerations are ipsilateral. If you're saying that somebody's got some cuts and bruises on either arm or on either side of the trunk, you could refer to it as contralateral. Contra means against or opposing. So contralateral means opposing sides or different sides. With that, we will cover more of the planes and sections next video. And good luck.